What happens to drug-induced lupus after drug withdrawal? When someone develops drug-induced lupus, stopping the medication usually leads to significant improvement. Unlike systemic lupus erythematosus, which is a chronic autoimmune disease, drug-induced lupus is directly related to certain medications. Once the offending drug is discontinued, symptoms often begin to resolve within a few weeks to months. The most common drugs linked to drug-induced lupus include certain antihypertensives, such as hydralazine and procainamide, as well as some anti-inflammatory drugs and others like isoniazid. After stopping these medications, many patients notice a reduction in symptoms like joint pain, fatigue, and skin rashes. Laboratory abnormalities, such as the presence of autoantibodies like antihistone antibodies, also tend to normalize over time. It is important to note that the resolution of symptoms and laboratory findings depends on how quickly the drug is stopped and individual factors like overall health and immune response. In most cases, symptoms improve completely, and the autoantibodies disappear within several months. However, some individuals may experience lingering symptoms or persistent autoantibodies, especially if the drug was used for a long time or if there was significant immune activation. Medical professionals typically recommend regular follow-up and blood tests to monitor recovery. It is also essential to avoid re-exposure to the causative medication, as this can trigger a recurrence of symptoms. Since drug-induced lupus is not a true autoimmune disease like systemic lupus erythematosus, it does not usually cause permanent organ damage if the drug is withdrawn promptly. If symptoms persist after stopping the medication, healthcare providers may investigate other causes or underlying autoimmune conditions. Overall, the prognosis for drug-induced lupus is excellent with proper management, and most individuals recover fully after discontinuing the offending drug. Always consult a healthcare professional for personalized advice and follow their guidance closely.